Welcome to the lecture session. We are going to talk about ARNI. ARNI means ARNI. ARNI means angiotensin receptor neprilysin inhibitor. And the brand name of the medicine is called sacubitril or valsartan. Its initial dose is 50 mg or 100 mg twice a day, and the target or maximum dose is 200 mg twice a day. ARNI is a group of medicine. ARNI means angiotensin receptor or neprilysin inhibitor. ARNI is medication it is a newer treatment for heart failure. The combination of sacubitril and valsartan has helped people live longer and have a better quality of life. Like all medicines, ARNI drugs have side effects. So in this video we are going to talk about overview of ARNI drugs, risks or benefits of ARNI drugs, recovery and outlook, and when to call the doctor. Overview of ARNI drug. What is an ARNI drug? ARNI, or an angiotensin receptor or neprilysin inhibitor, is made up of two drugs put together to treat heart failure. It contains an ARB, that means angiotensin 2 receptor blocker, and a neprilysin inhibitor. Sacubitril or valsartan is the only ARNI drug available now. The Food and Drug Administration approved the drug in 2015. That means only 10 years ago. The drug was approved by the FDA of the United States of America. So this is the latest form of heart failure drug. Now the question is, how does ARNI work, or how ARNI works? Valsartan is the ARB part of an ARNI drug. It lowers your blood pressure by keeping your blood vessels from constricting. Sacubitril is the neprilysin inhibitor. Inhibiting or limiting neprilysin allows your body to number one, get rid of more sodium, simply salt, to number two, to open your blood vessels wider, and to make more pee. Pee means urination, or making urinate. When your body gets more sodium or salt out of your body, your blood pressure comes down. This makes it easier for your heart to push blood out to your cells. Now let's talk on who can take an ARNI medication. You can take an ARNI drug if you just got a diagnosis of heart failure with a reduced ejection fraction. Ejection fraction is a measure of your heart's pumping function of 40% or less. If your heart's ejection fraction is 40% or less than 40%, only then you can take an ARNI drug, or simply sacubitril and valsartan. A normal ejection fraction is 55% to 65% in a normal human healthy heart. Also, you can switch to an ARNI drug if you are taking an ACE inhibitors. ACE inhibitors means angiotensin converting enzyme inhibitors, or ARB, angiotensin receptor blockers for heart failure. However, if you are switching from an ACE inhibitor to an ARNI medication, you will need to wait 36 hours between stopping one and starting the other. This prevents swelling that could happen under your skin, which is in medical science called angioedema. Angioedema is the swelling that happens under your skin. What dose of ARNI do I take? The question is, what dose of ARNI medication do I take? Most people start with a dose of 49 by 51 mg or milligrams sacubitril and or valsartan. That means 49 gram 9 milligram sacubitril and 51 milligram valsartan twice a day. That means 2 times in a day. After the first 2 to 4 weeks, they gradually increase their dose up to 97 mg sacubitril or and valsartan 130 mg, that means 200 mg twice a day. Sacubitril or valsartan twice a day. Your provider will give you guidance in figuring out your dose. If your kidneys are not working well, or if you have low blood pressure, you may take a dose of 24 by 26 mg sacubitril and valsartan. Also, that means 50 mg sacubitril and valsartan, which is called Entresto. Also, people who have already been taking a small dose of an ACE inhibitor or ARB may take this smaller dose of an ARNI medication instead. Now the question, why is ARNI used? Many people start taking an ARNI drug because they want to stop taking an ACE inhibitor that makes them cough. If you are taking an ACE or angiotensin converting enzyme inhibitors drug, it can make you cough. So that also an ARNI medication helps your left ventricle work better. Left ventricle is your main pumping chamber of your heart. This is important because your left ventricle pumps oxygen-rich blood to your whole body. One study showed that after taking ARNI medication for a year, people increased their left ventricle's ejection fraction from 28.2% to 37.8%. If you take ARNI drug for a year, your ejection fraction rate will increase by 28% to 37% plus. Now let's talk on a question, who should not take ARNI drugs? Who should not take ARNI drugs means who should not take angiotensin receptor neprilysin inhibitor. You should not take ARNI drugs if you got angioedema or facial swelling, if your face swells, balloons out. When you take an ACE inhibitor or ARB drug or angiotensin, ARB means angiotensin receptor drugs, angiotensin receptor blockers, and ACE means angiotensin converting enzyme inhibitors. If you are pregnant or if you are nursing, if you are still taking an ACE inhibitor or an ARB drug, if you have a serious liver problem, if you are taking aliskiren, if you are overly sensitive to ARBs or ARNIs. What does ARNI treat? The question is, what does ARNI treat? ARNI drugs treat heart failure with reduced ejection fraction, stage C. During stage C of heart failure, you have structural heart disease and heart failure symptoms. Also, ARNI medication can help people who have heart failure with preserved ejection fraction, normal pumping function, but your heart is stiff and cannot hold as much blood. This is an ejection fraction of 50% or higher. How common are ARNI drugs? Only about 10% of the more than 2 million people who could benefit from an ARNI drug are using it. Possible reasons for this low usage of ARNI drugs include: number 1, providers are not familiar with ARNI medication. Number 2, providers don't want to change medications for people who are unstable on other drugs. Number 3, insurers won't pay for ARNI drugs. Number 4, people are not willing to switch to a different medicine. Now we are going to talk about the risks or benefits of ARNI drugs. What are the advantages of ARNI drugs? Compared to ACE inhibitors or ARBs, ACE means angiotensin converting enzyme inhibitors and ARB means angiotensin receptor blockers. ARNI drugs can, number 1, help you live longer. Number 2, ARNI drugs can improve your quality of life. Number 3, ARNI drug can slow down your heart failure progression. Number 4, ARNI drugs can reduce the amount of time you spend in a hospital. Every year, about 600,000 people, that means 6 lakh people, die from heart failure. ARNI medication could prevent more than 28,000 deaths per year if providers prescribed it to more people instead of ACE inhibitors or ARBs, angiotensin converting enzyme inhibitors, or angiotensin receptor blockers. A large study found that participants taking an ARNI drug had a 20% drop in their risk of cardiovascular death or hospitalization for heart failure. I repeat, a large study found that participants taking an ARNI drug had a 20% drop, 20% fall in their risk of cardiovascular death or hospitalization for heart failure. Now the question, what are the side effects of ARNI medication? Science, whatever science has been discovering for us, every result of science has some side effects or has some disadvantages. So what are the side effects of ARNI medication? ARNI side effects include: number 1, kidney dysfunction; number 2, low blood pressure or hypotension; number 3, high potassium or hyperkalemia; number 4, angioedema, which is very rare but more common in black people if you have a black skin, if you are from African descent. Your healthcare provider will need to do a blood test to check your potassium level during the first few weeks that you are taking an ARNI drug. They will also want to check your blood pressure and make sure your kidneys are working right. If you are having kidney issues, you may need to take a smaller dose of ARNI medication or stop taking it. Your provider will advise you about what you should do. Don't stop taking ARNI medication unless your provider tells you to stop. You can keep your blood pressure from getting too low by taking blood pressure medicines. At different times than your ARNI dose. Talk with your healthcare provider about spreading out the timing of your blood pressure medicines. Side effects normally go away in 14 days. Side effects normally go away in 14 days. If they don't go away, your provider can give you a smaller dose of ARNI medication, like the 50 mg starting dose, twice a day. Then they can increase your dose a week or two after your side effects stop. Now let's talk about the recovery and outlook of the ARNI drug. What is the outlook for someone taking an ARNI drug? Estimates based on studies predict that ARNI medication may give a person age 55 or older another 2.1 years without a heart-related hospital stay or fatal event. Some people age 65 or older may get another 1.6 years without those occurrences. Now, when to call the doctor? When should I see my healthcare provider or doctor? Contact your healthcare provider if you have dizziness, if you have lightheadedness, if you have fainting, if you have low blood pressure, a systolic or the first number lower than 90 millimeters of mercury. So in this case, you should see your healthcare provider. Although you may feel safer sticking with a medication you have taken for a while, it may be worth trying a new one. Talk with your healthcare provider about the benefits and disadvantages of trying a new heart failure drug. Understanding the study results and your provider's opinion on it can help you make an informed decision that's best for you. When your heart needs some help, the cardiology experts are here for you always. The cardiology experts always diagnose and treat the full spectrum of cardiovascular diseases. So don't be hopeless, rather be hopeful about if you have any kind of heart related problems. Whenever you see any heart problem, just go to a cardiologist, go to a cardiac surgeon, go to an interventional cardiologist. They will help you. They are ready to help you. So there is hope. There is there is there is optimism that you can live longer though you have a heart problem, you have a valve problem, or anything else related to heart. So don't worry, don't be hopeless, be hopeful, and whenever you have a heart problem, please visit a cardiologist or visit a heart doctor. So wishing you all a good heart, good health, and wishing you all a better tomorrow and a better future. Thank you. Bye bye. And thank you once again for watching and listening to this video. Thank you. Bye bye.